New data suggests parts of California may be seeing more COVID transmission right now than during the record-breaking Omicron surge over the winter. Now, here in San Diego County, the confirmed daily case numbers have been well above the 1,000 or 2,000 marks just over the past week. Doctors say the BA.5 subvariant is striking a huge number of people who previously had COVID. And some health experts wonder if the CDC's quarantine guidelines are too short to deal with this super infectious subvariant. Inside San Francisco's sewers, there's now more coronavirus circulating in the wastewater than there was during the massive Omicron surge in January. So far, San Diego's monitoring stations show we're still about 1/4 of the way to last winter's peak. But scientists are finding steadily more virus, and almost all of it is BA.5.
We're not quite there yet in terms of peak. And what this tells us is it's not going to be over at least 2 more weeks. We're still not going to be over this. Now, a couple of days later, if it's still going up, then we know 2 more weeks into the future, it's not going to be over. So we're not there.
Dr. William Singh of Kaiser says BA.5 continues to spread fast because it's able to easily reinfect people, particularly those who haven't been vaccinated in a while. In June, San Diego County recorded more than 3,100 reinfections, nearly double the figure from May.
This variant does escape the vaccine immunity against infection, not against hospitalization or death. But from an infection standpoint and transmission, you can still get reinfected.
In some cases, people are getting reinfected with BA.5 in as little as 1 month following a previous bout with COVID.
Most of the people who are getting BA.5 now are ones who had old-fashioned Omicron.
UC San Diego's Dr. Robert Schooley points out 1 month ago, more than 90% of the circulating COVID was not BA.5. So you can't count on protection if you aren't certain what variant you had. BA.5 is super infectious for 2 main reasons. Today's vaccines are based on a version of the virus from 2019, so they produce antibodies that aren't in ideal shape. And once BA.5 enters a cell, studies show it can make many, many more copies of itself. So every breath or cough from an infected person carries more virus. CDC guidelines say infected people can leave quarantine after 5 days if they don't have a fever. They're supposed to wear a mask for 5 days after that. But some health experts say that 5-day quarantine is too short with BA.5, since there's evidence original Omicron can stay infectious for 8 days or longer.
I do think that in general, if we're trying to get the pandemic under control again, we need to both think about lengthening the time for isolation, or at the very least having people be really careful about masking up when they go out, if they go out earlier than 10 days.
And both doctors I spoke with are urging everybody to mask up indoors right now. Based on the rate of asymptomatic infections they're seeing up in San Francisco, if you're in a group of 100 people, there is a 99.7% chance somebody in that group has COVID.